You all know what you have to do. No one, and I mean no one, comes into our house and pushes us around. It's your game.
Healthcare expenses in this country are caused by malpractice suits. So that really is not a fix at all. That really is just using one tiny thing. What we need is a plan that covers all areas of expenses. We need to get availability. When you increase the risk pool, then you increase the amount of money that is there for people to use for healthcare. When you make it more available, what they said about the public option, I believe they used the words free. It is not free. It is run off premiums that people who want the health care will pay. So it is not a free system. When the health care plan public option would increase 5% of the people that are uninsured right now. The 50 million uninsured people would take this option according to the CBO. Thank you.
I don't know exactly what it is you're trying to do then. I mean, people can pay for premiums right now. If it's not free, if people can't afford to pay for it now, what makes you think that they're going to be able to afford it by the government? And also, you said less than 1/2 of 1% of the cost in our medical system is because of runaway medical malpractice suits. That's just wrong. I'm not exactly sure where you got your information from, but I mean, it varies state by state, and it accounts for 20 to 30% of the total cost when you take into account the front end of it, which is the actual court cost, and the back end of it, the defensive medicine, the cost accrued by that. So again, if we're trying to really fix the problem, we have to understand exactly what is wrong with it so we know the best way to do that. You know, you talk about competition in the public option. I mean, if you have the public option, that's one person competing. Take the state of Alabama, for example. They currently have 8 to 9 insurance companies. If you enact the public option, that's one more person to compete with them. How about we take down state boundaries so then they can compete with 1,300 more people, 1,300 more insurance companies? That's real competition, and it wouldn't cost us trillions of dollars to do that.
15% of American citizens do not have health insurance. Some choose not to buy it, others are not able to afford it. Irrespective of their health coverage, the vast majority of those people are able to receive emergency care, typically directly or indirectly at public expense. Also, health coverage isn't distributed equally across racial and ethnic groups. Minorities are less likely to be covered than whites. Where does responsibility for ensuring that a person's health care needs are met lie? Is there a personal obligation to provide for coverage? If a person chooses not to provide for his or her coverage, is it the public's responsibility to do so? Is there a right to health care?
Okay, well, I want to, right now, I want to.
Shh, excuse me. Let's let them answer it, okay?
Right now, I want to make a distinction between natural rights, things like life, liberty, these things that you're born with, and positive rights, rights that are afforded by the government. Now, we're not born into an educational system. We don't receive education the second that we're born. This is something that is afforded by the government, that the government provides for us. We don't have a right to education per se if you base it on libertarian principles. Now, the right to health care, the way I view it is that if we're going to allow individuals to access the emergency room, what makes that individual qualitatively any different than someone that has cancer? What makes a person that just was in a car accident and gets rushed to ER any different than the person that's suffering from cancer? Why do we allow this person to survive and this person to die?
Okay, I think we need to make one thing clear in this healthcare debate. This is a key central issue to this whole debate. The difference between a right and an entitlement. Governments do not create rights. That is a fact.
This is coming out of your tongue, so just...
Also, I'd like to point out your 47 million number, approximately, I think it's about 15 million of those, or 10 million, excuse me, are illegals. And approximately 15 million per capita make $50,000 or more. So they are choosing not to have health insurance. So if you're going to include the numbers, try and make them accurate. And I know you said 50 million, some Democrats have said 47. The truth is they don't know, but it's a big number, and it sounds good to get emotional votes and pander to people who don't understand the issues.
Also, it's not a right if it infringes on another citizen's rights. What about the rights of our doctors? Don't they have a right to go out and earn a good living? Don't they have a right? Don't they have a right to provide health care for the customers that they choose, to charge the prices that they want to choose? This is what a free market is. If a doctor is charging too much money, you go to the other doctor. That's all there is to it. It's an entitlement. The same thing that they want to call it a positive right, a right that the government creates. So someone like the late Ted Kennedy can sit there and write on a piece of paper something that maybe his constituents have a need for, and all of a sudden it goes into legislation and it's now a right? Now every other person born after that is just going to have that given to him? Who pays for this? The government isn't a company. You pay for it. I pay for it. We all pay for this. Thank you.
If we're going to classify these things as entitlements, then you also have to view education as an entitlement. You're not born with education. You're not born with a right to education. You're infringing on the rights of the teachers to charge whatever salary they want. This is, if you're talking about doctors' autonomy, what difference is there between teachers' autonomy? Why is that distinction made there? And another thing is, when it comes to talking about the free market, if we are to afford all of our citizens equality of opportunity, one of the main tenets of Republicanism, that necessarily rests on the idea there is a level playing field where individuals can compete. However, individuals who cannot afford healthcare are at a competitive disadvantage because they're not able to buy into healthcare and are more likely to go into debt and are not able to compete equally against those with healthcare. There's a competitive disadvantage. If you want to talk about equality of opportunity, afford that basic right for people.
And as for the immigrant thing, actually all foreign-born people, including immigrant workers who have legal status and who have lived in, who have illegal status, and others who have lived in the U.S., account for somewhat less than 1/4 of the uninsured in this country, according to U.S. Census Bureau.
All right, one more point. You made very clear that many people choose not to have health insurance, but them not having health insurance affects us all because you said you're paying for it, they're paying for it now. There is a hidden tax in your health insurance where you pay about $1,000 a year. You pay about $1,000 a year for those people who don't have health insurance to go to the ER and get coverage when they need it. So, you know, by having everybody buy health insurance and having everybody get into a system where there aren't as many uninsured people, you're saving money.
No, that would be redistributing the wealth between the healthy young citizens as ourselves who might choose not to have it and the old sick citizens.
Well, and I don't exactly understand what you're trying to do here. You know, at first we're saying we're just trying to, keep insurance companies honest. We're trying to give them competition, and there's people with pre-existing conditions who we need to help out. Now you're saying healthcare is a right, and everybody needs to have it because it's going to save you money. And an individual doesn't know for themselves whether or not they want to purchase it and what's best for them. The government says because it will save us all money, you have to get health insurance. Or are you saying that just because we won't let somebody die on a hospital floor that we have a right to it? That means that we all have to individually pay into a pool to cover the whole government, to cover the whole country. I'm not exactly sure what it is you're trying to reform. And until we know, exactly what the problems are and what steps we should take to address it, we're just like trying to shoot fish in a barrel here. This is a very complex system, and you can't just throw everything out at once and hope that something sticks. We have to know exactly what it is that you want to change, why you want to change it, and how you think it should be changed. You can try and pull on our heartstrings, and you can try and paint us as bad people because we want people with cancer to die, which is not right. The fact of the matter is we need to know exactly what it is that we're doing here. We not only care about the people, we care about our country as a whole, and we care that we're not enacting foolhardy legislation that's going to do more harm than good.
May I ask